Imagine waking up and feeling a small, uncomfortable lump in the arch of your foot. It might not hurt much at first, but over time, it grows, and so does the discomfort. Walking, standing, or even putting on a pair of shoes becomes a challenge. This lump, called a plantar fibroma, may be small, but the impact it can have on your daily life is far from tiny. Section 1. What is a plantar fibroma? Let's get right to it. A plantar fibroma is a mass of fibrous tissue that forms right in the middle of the foot's arch. It's typically a benign, non-cancerous growth, but that doesn't mean it's harmless. It can cause significant pain and discomfort as it grows or when pressure is applied. Plantar fibromas are most common in middle-aged individuals and tend to affect men more than women. In some cases, you might find multiple fibromas, which can make daily life even more challenging. Section 2. Recognizing the symptoms. If you're wondering how to recognize a plantar fibroma, look for a slow-growing lump in the arch of your foot, typically measuring less than an inch. At first, it might not cause much trouble. But as it grows, you'll notice it starts causing pain, especially when you press on it, wear tight shoes, or walk barefoot on hard surfaces. The lump becomes more sensitive over time, and daily activities like walking, standing, or even putting on shoes can feel like a chore. Section 3. Possible causes. What causes a plantar fibroma? To be honest, we don't have a solid answer yet. It may have a genetic link, as studies show it's more common among people of Northern European heritage. Trauma to the foot is also considered a potential trigger, especially repetitive injuries that cause small tears in the fascia. Lifestyle and certain medical conditions can also be contributing factors, but they likely don't cause it directly. Section 4. Diagnosing plantar fibroma. If you're experiencing symptoms, the next step is diagnosis. A doctor will examine your foot and press on the lump to check for pain. They'll also assess your ability to walk and stand. If needed, imaging tests like X-rays or MRI scans may be recommended to rule out other issues, such as cysts, infections, or tumors. A biopsy is rarely necessary unless imaging suggests the growth might be something other than a fibroma. Section 5. Potential complications. Despite being non-cancerous, plantar fibromas can lead to complications. For example, as the fibroma grows, it may alter the shape of the arch and cause significant walking or standing problems. In severe cases, surgery might be necessary to remove the mass, but as with any surgical procedure, there's a risk of complications. Even if surgery successfully removes the fibroma, there's a chance it could come back, especially if you have multiple fibromas. Section 6. Treatment options. Let's talk about solutions. The treatment goal is to reduce pain and limit the growth of the fibroma. Here are some common approaches. 1. Topical gels. These are designed to slow the growth of fibrous tissue. Some users claim they help with pain, but the scientific evidence is mixed. 2. Corticosteroid injections. A steroid shot can temporarily reduce pain and inflammation, making it easier to walk. However, it won't stop the fibroma from growing and needs to be repeated as the effects wear off. 3. Orthotic insoles and pads. Custom orthotics can make a huge difference by redistributing pressure away from the fibroma. By cushioning your arch, you'll experience less discomfort throughout the day. 4. Physical therapy. Gentle stretching and strengthening exercises can promote blood flow, reduce inflammation, and even encourage new cell growth. A physical therapist can design a plan tailored to your needs. 5. Surgery. If other treatments don't work, surgery may be the last resort. It's effective, but it comes with risks. Post-surgical complications may include flat foot or hammertoe, and there's a chance the fibroma could come back. Section 7. Home remedies and pain management. If you're not ready for medical treatments, there are a few home remedies to help manage pain. Ice. Applying an ice pack for 15 minutes can reduce pain and swelling. Try doing this several times a day. Elevation. Prop up your foot to reduce swelling. By elevating your foot above your heart, you'll notice a decrease in inflammation. Over-the-counter pain relief. Pain relievers like ibuprofen or acetaminophen can be effective. But remember, these medications should only be taken as needed, and long-term use isn't recommended due to potential side effects. Section 8. The road to recovery and prevention. Recovery and prevention are key. Once you're dealing with a plantar fibroma, you want to focus on maintaining a lifestyle that minimizes the risk of recurrence. This means wearing supportive shoes, avoiding trauma to the foot, and staying proactive about any foot discomfort. If surgery is necessary, expect a recovery period of up to 8 weeks. Remember, even with treatment, recurrence can happen, especially if you have multiple fibromas. Conclusion. Plantar fibromas can start off as a small, barely noticeable lump, but as they grow, they can significantly impact your quality of life. The good news is, there are various treatment options available, from topical gels and physical therapy to corticosteroid shots and, if necessary, surgery. If you're struggling with a plantar fibroma, consider consulting a healthcare provider to explore your options. Remember, with the right approach, you can take steps to manage this condition effectively. Take control of your foot health and don't let a small lump hold you back from moving comfortably.